NQPHN acknowledges the traditional owners of Australia's First Nations people, and we respect their continued cultural, spiritual connection to country, waters and kins.
I'd like to introduce you to Amanda Suter as well, who's our business analysis for the Queensland Ambulance Service and a part of the NEPT deployment team as well. Amanda, do you want to, I'm still trying to load the presentation.
Yeah, sure, I'll load it up now.
You can take it away if you like, and I'll just...
Yeah, sure, I've just pushed present in Teams, so I'm hoping that it's going to, yes, let me present. Okay, can everyone see the QAS NEPT request system slide there?
Yes.
Yeah, perfect. Okay, so we just, this is about the NEPT system, which we are rolling out. So what is NEPT? It's a non-emergency patient transport request system that's an online platform implemented by the QAS to improve the process for Queensland Health and private medical facilities to request non-emergency patient transport for eligible patients. So we are replacing the existing manual paper-based medically authorised ambulance transport forms, as well as calling 13 12 33. And we're hoping this will assist and aid in the reducing any time lost by healthcare providers by filling out forms manually, faxing manually, and also making any changes to patient transport. So whether that be letting QAS know that it's been changed or cancelled, or if the patient's ready to be picked up now. So the NEPT solution has been developed on a ServiceNow software as a service offering and will be available for all users via a web page. So people can save that web page as a favourite, the same as you would save any other web page. The current process, so currently facilities, when they're trying to book a non-emergency patient transport for their patients, they will either call 13 12 33 and talk to an emergency medical dispatcher, and that emergency medical dispatcher will manually enter that request into our computer-aided dispatch system. They also fill out the medically authorised ambulance transport form, which they get the doctor to sign, and then they fax that into the QAS or email it in. This is just an example of what we receive now. So as you can see, it's very hard to read. We have missing information that's actually required for the transport. And in some cases, it's faxed the wrong way, so we don't actually get any information and we have no idea who's sent it through to us. So implementing NEPT will ensure that we're capturing the details we need up front. We won't need to contact you to find out any additional information. So the future process, so facilities can still call 13 12 33 and an emergency medical dispatcher will just enter it into NEPT on your behalf. However, we are requesting that all facilities will join onto the NEPT system, and they will have their own link, their own login and passwords to the NEPT system. They can go in there, they can see all of the NEPT requests for their patients, and they can create, modify, cancel any requests within there. They can also see when QAS have updated a trip, so they can see when it's confirmed, so they no longer need to fax a form and then wait 5 minutes and call the QAS to make sure that we've actually received the document. And in Southeast Queensland, Queensland Health have a RACH solution, which they put in all of their facility transfers, so that's inter-ward transfers, things like that. We've also integrated with that. We've also integrated with our computer-aided dispatch system, so that the EMD will then just need to check the NEPT request and send it through to our CAD system. That will then send back the confirmation, which then the facility will see that confirmation. So you have all of the information at your fingertips. So the benefits of NEPT. So we are eliminating the inefficient faxing and scanning of manual paperwork, reducing phone calls. So you no longer, as I mentioned, you don't need to call the QAS anymore. You can just request through the web form. For the bigger facilities, if you have patients that are often sent to your facility from other facilities, you will actually be able to see those requests to transport so you'll know who's coming in and who's coming out. You can see the current trip status view, so you can see when QAS have updated it and have confirmed the trip. As I mentioned earlier, the QAS confirmation number is provided on all of the confirmed bookings, and because it's based on a ServiceNow platform, which is it's very simple to report from. So you can modify what fields you want to report on, and you can basically create your own reports in the system and export them as needed. So the limitations of NEPT. So NEPT is only used for non-emergency. So emergency requests for ambulance assistance, so that's your Red 1Bs, category 1 and 2, and any urgent requests for transport, so the Red 2As, 2Bs, 2Cs, and categories 3 and 4, they will still need to go through calling 000. For any retrieval services Queensland transports, so that's generally transports that are over 200 kilometres, they will still need to be coordinated through Retrieval Services Queensland, or RSQ, and any interstate patient transports. So if we're transferring a patient from Queensland to New South Wales or vice versa, they'll need to be coordinated through calling 13 12 33. So in the NEPT system, at a facility level, there are 3 levels of users. So the general user, that might be your RN, an admin officer, doctors, anyone that's basically requesting the non-emergency patient transport. So they can create requests, modify requests, cancel requests. Then we have a validation user. This is generally for larger hospitals. If they want to verify any requests for transport before they're sent to the QAS. We've rolled out in Cairns since June last year. They've been using NEPT, and we haven't had anyone use the validation user role yet. So that's kind of used in those really large facilities, and most likely will be down in Southeast Queensland. And then we have an administration user. So we envisage this role will be either the IT department, admin officers, a DON, NUM, or a practice manager. So this role is responsible for creating users within the facility. So as new users come on board into the facility, you can create user access for those facilities, for those users, sorry. They also are the first tier of support for NEPT. So if the user is having any difficulties with printing a request or doing anything like that, they're the first person that user will go to get assistance. If they can't assist, then it can be escalated to QAS. As I mentioned, we do have a CAD interface, so it does provide data integration confirmations. So it does say, yes, here's your QAS confirmation code. We will upload all of our facility data that we have currently in our computer-aided dispatch system into the NEPT system. So we will have all of the facilities in there. If they're not in there, then the facility can request access to NEPT. And we also have patient matching, so that from our computer-aided dispatch side, we have just the one patient, even though that one patient may be across multiple facilities. Because we are moving away from a paper-based process, we have some inbuilt system-generated notifications. So you can have your patients opt in to get an SMS or an email 72 hours before their appointment, just letting them know that they need to be ready from a specified time. We also have inbuilt notification for private facility doctors. So if something's been booked on their behalf, they'll receive an email to say this has been booked on your behalf. And NEPT also sends user creation, password resets, new facility and support task emails. So a lot of the workflow in NEPT is supported by email communication as well, and notifications. So facilities to be onboarded into NEPT. So all facilities will be required to complete a facility access request form to have their facility created. And to assign a facility administration officer. So even if we've uploaded your facility from CAD, you'll still need to fill out this form to apply the administration officer to your facility. So the QAS will validate all of the requests that come through to be a facility within NEPT. We can add wards or validating hubs in NEPT if required. So for a residential aged care facility, that may be you want to have each of your areas in there, so all of your wings as separate wards. And as mentioned earlier, the NEPT facility administrators will be responsible for all user management within their facilities. And the links to the facility access form request form will be available via the QAS website once we've fully deployed across the state. I believe all of this information has been sent out already and will be sent out as part of the communication process as we move forward to deployment, which I'll discuss a little bit later in this slide. So to get support in NEPT, so we do have a NEPT support task workflow within NEPT. So you can do that from a trip level. So when you create a trip, you can create a support task. You can also do it from, there's a dedicated support task help section. As I mentioned, the facility administrators are tier 1 support for most issues. So that's just because we can't really assist with things like being unable to print requests and things like that. That is probably more of an internal facility issue. We can also, if you see your facility details and you want to add or remove or modify details, so say you need to add a new wing or a new ward, you can request that via the support task as well. So all of that information is provided in training as well, which is the next slide. So there's quite a comprehensive training package that's been developed, and it's all available from within the NEPT application, as well as in the new user emails. There's links to all of the training guides. So there is a full online training package which users can skip through all of the training for NEPT. We've also developed some quick reference guides and videos to assist users. They're a really great resource. We really recommend that people print those off and just have them around the office, because they're basically one-pagers on how to do things in NEPT. Then we have the full training manuals available, and we have a frequently asked questions and answers, which will be updated as we deploy around the state. So the deployment process for 2024. So as mentioned, we have deployed in Cairns already, and they have been using it since June. The next location we are going is Townsville. So the timeline for the residential aged care facilities and medical centre onboarding will be commencing from the 8th of April to 2024. So the PHN email communication will be from the 11th of March. There is potential for face-to-face introduction sessions for large users of the QAS non-emergency patient transport services, and I believe the emails have started to be sent out from the QAS to those facilities to invite them to respond to see if they want to have us on site. So we'll be up in Townsville for a few weeks from the 8th, so we can actually come out and sit with your staff to show them how to use the system, assist in getting you set up on all of that sort of thing. We also offer Teams online training sessions for all private medical facilities on receipt of an online request. So again, that information is provided in the information packs that will be sent out. That was a really quick high-level overview. So does anyone have any questions? And I do have an offer of providing a quick demonstration if people have time. I know that we only have a short time frame in this meeting, so I thought I would just see what the appetite is for that.
Thanks, Amanda. Yep.
I was going to say I'm happy to Heather Winston. Sorry, Sandy, if you would like a demonstration or as you feel relevant.
I'm all good, thank you.
You're good, excellent. So yeah, any questions, feel free to contact Sarah and myself. So Sarah's the product manager of NEPT. And we have a nept@ambulance.qld.gov.au email address. So if you do have any questions, yeah, feel free to reach out to us. If you want to request any training, anything like that, reach out to that email address. But as I mentioned, a lot of the communication has already started to trickle through. So hopefully everybody is starting to receive that information.
Is there anything that I can provide in the minutes or further to these guys at the moment? Or you said there's something coming out from PHN?
Yeah, so we do have an information package that we can send to you if you like to distribute as well. The PHNs have already started some of that communication strategy coming out in that last newsletter that came out.
Yep.
But we're happy to send it to you as well, the information package, so they can get ready type of thing. And then I'm happy to CC you in as well when I say go to the PHNs if you like, about when to start registering.
Okay, and then I could just send it out to this little group maybe as
Yeah,
an
absolutely.
extra?
Yeah.
In case they miss it in their emails.
Yeah.
Just another email to add to the list.
Yes.
No worries. Any other questions from anyone? No? Thank you so much, guys. That was really great. And they can always reach out. All the RACHs can reach out for a demonstration if they need to.